Chronic inflammation is a process in which the immune system becomes activated for an extended period of time. While inflammation is a natural and necessary response to infection and injury, chronic inflammation can lead to tissue damage and contribute to the development of various diseases. This is the reason why it is vital to control chronic inflammation. When the immune system is constantly activated, it can produce a variety of harmful substances, including cytokines, reactive oxygen species, and free radicals. These substances can cause damage to healthy cells and tissues, leading to chronic diseases such as heart disease, diabetes, cancer, and autoimmune disorders. By reducing chronic inflammation, it is possible to reduce the risk of developing these diseases. Lifestyle changes such as eating a healthy diet, exercising regularly, getting enough sleep, reducing stress, and avoiding exposure to toxins can all help to reduce chronic inflammation. In some cases, medications or other treatments may also be necessary to manage chronic inflammation and prevent disease. It's important to note that inflammation is a complex process, and some degree of inflammation is necessary for the immune system to function properly. So the goal should not be to completely eliminate inflammation, but to reduce excessive and chronic inflammation. By doing so, we can help to maintain overall health and well-being and reduce the risk of chronic disease. In this video, we'll discuss the different triggers of inflammation and ways of minimizing them. Before we continue, give us a like and subscribe to our channel and be notified of our next videos. Inflammation can have many different causes, but here are 8 common triggers of inflammation. 1. Poor diet. Consuming a diet high in sugar, refined carbohydrates, trans fats, and processed foods can trigger inflammation in the body. 2. Chronic stress. Long-term stress can lead to inflammation in the body, as stress hormones can activate the immune system and cause inflammation. 3. Lack of sleep. Chronic sleep deprivation can trigger inflammation in the body by disrupting the body's natural immune system function. 4. Sedentary lifestyle. Lack of physical activity can lead to inflammation in the body, as exercise is known to have anti-inflammatory effects. 5. Environmental toxins. Exposure to toxins such as pollutants, pesticides, and chemicals can cause inflammation in the body. 6. Infections. Chronic infections or persistent infections can cause inflammation in the body, as the immune system tries to fight off the infection. 7. Autoimmune disorders. Autoimmune disorders can cause the immune system to attack healthy tissues, resulting in chronic inflammation. 8. Aging. As we age, chronic low-grade inflammation can develop in the body, contributing to the development of age-related diseases. Chronic inflammation can cause a wide range of health problems and increase the risk of developing certain diseases. Some of the potential consequences of chronic inflammation include cardiovascular disease. Chronic inflammation is believed to contribute to the development of heart disease, atherosclerosis, and stroke. In 2002, a study published in the New England Journal of Medicine found that elevated levels of C-reactive protein CRP, a marker of inflammation, were associated with an increased risk of cardiovascular events such as heart attack and stroke. The study followed over 27,000 apparently healthy women for 8 years and found that those with the highest levels of CRP were at twice the risk of cardiovascular events compared to those with the lowest level. Type 2 diabetes. Chronic inflammation can impair the body's ability to regulate blood sugar levels, which can lead to insulin resistance, obesity, and type 2 diabetes. In 2003, a study published in the Journal of Clinical Investigation found that adipose tissue fat tissue in obese individuals produces higher levels of inflammatory cytokines such as tumor necrosis factor alpha TNF-alpha, interleukin-6 IL-6 than in non-obese individuals. These cytokines can interfere with insulin signaling, leading to insulin resistance, which is a major risk factor for type 2 diabetes. Arthritis. Chronic inflammation can cause joint pain, swelling, and stiffness, leading to conditions such as rheumatoid arthritis and osteoarthritis. A study published in 2007 in the journal Osteoarthritis and Cartilage found that cytokines and other inflammatory mediators were present in the joint fluid and cartilage of patients with osteoarthritis, a degenerative joint disease characterized by joint pain and stiffness. These mediators can contribute to the destruction of joint tissue and exacerbate symptoms of osteoarthritis. These and other studies have highlighted the crucial role that chronic inflammation plays in the development and progression of joint diseases such as rheumatoid arthritis and osteoarthritis. By modifying your lifestyle and dietary habits, it may be possible to slow the progression of these diseases and alleviate symptoms such as joint pain, swelling, and stiffness. Neurodegenerative diseases. Chronic inflammation has been linked to the development of Alzheimer's disease, Parkinson's disease, and multiple sclerosis. In 2007, A study published in Nature Neuroscience found that chronic inflammation can contribute to the development of Alzheimer's disease by activating immune cells in the brain called microglia, which release pro-inflammatory cytokines and other toxic molecules. These molecules can damage neurons and contribute to the formation of beta-amyloid plaques and neurofibrillary tangles, which are characteristic features of Alzheimer's disease. Similarly, a study published in 2010 in the Journal of Neuroinflammation found that chronic inflammation can contribute to the development of Parkinson's disease by activating microglia and inducing the production of pro-inflammatory cytokines and reactive oxygen species. These molecules can damage dopaminergic neurons in the substantia nigra, leading to the motor symptoms of Parkinson's disease. Cancer. Chronic inflammation can promote the growth of cancer cells and increase the risk of developing certain types of cancer, including colon, liver, and lung cancer. In 2013, a review article published in the journal Cancer Research highlighted the role of chronic inflammation in promoting the growth of cancer cells and increasing the risk of developing colon, liver, and lung cancer. The article explained that chronic inflammation can induce DNA damage, promote angiogenesis, the growth of new blood vessels, and suppress immune surveillance, all of which can contribute to the development and progression of cancer. Similarly, a study published in 2015 in the journal Cancer Cell found that chronic inflammation can promote the development of liver cancer by inducing the expression of a protein called S100A, which triggers the activation of immune cells and promotes the proliferation of cancer cells. Digestive issues. Chronic inflammation can damage the lining of the digestive tract, leading to conditions such as inflammatory bowel disease (IBD) and ulcerative colitis. In 2018, a study published in the journal Nature Communications found that chronic inflammation can damage the lining of the digestive tract and promote the development of IBD and ulcerative colitis by inducing the expression of a protein called IL-23, which triggers the activation of immune cells and promotes the production of pro-inflammatory cytokines. Finally, a study published in 2020 in the journal Frontiers in Immunology found that chronic inflammation can promote the development of IBD by disrupting the balance of gut microbiota and inducing dysbiosis, which can trigger immune responses and promote the production of pro-inflammatory cytokines. There are many natural treatments that can help reduce chronic inflammation. Here are some of the best options. Number 1. Anti-inflammatory diet. Eating a diet rich in whole, unprocessed foods, such as fruits, vegetables, whole grains, and healthy fats, can help reduce inflammation in the body. 2. Probiotics. Consuming probiotics, found in fermented foods like yogurt, kefir, kimchi, and sauerkraut, can help improve gut health and reduce inflammation in the body. 3. Turmeric. A spice commonly used in Indian cuisine, contains curcumin, which has potent anti-inflammatory properties. At number 4, ginger. Ginger is another spice with anti-inflammatory properties, which can be added to meals or brewed into tea. 5. Exercise. Regular exercise can help reduce chronic inflammation, as it can improve immune system function and reduce stress level. 6. Stress reduction. Managing stress through techniques such as meditation, deep breathing, or yoga can help reduce inflammation in the body. 7. Sleep. Getting enough quality sleep is crucial for reducing chronic inflammation, as sleep deprivation can lead to inflammation in the body. Last but not least, 8. Omega-3 fatty acids. Consuming omega-3 fatty acids, found in fatty fish like salmon, as well as nuts and seeds, can help reduce inflammation in the body. It's important to note that these natural treatments can be helpful in managing chronic inflammation, but they are not a substitute for professional medical advice. If you have a medical condition that causes chronic inflammation, it's important to work with your healthcare provider to develop an appropriate treatment plan. That's all for this video. We hope you like it. Let us know what you think by leaving a comment. Don't forget to subscribe and smash the like button. To your health.